Welcome everybody to our department seminar today. I'm delighted to welcome Professor Cynthia Crawford from the University of Toronto, who is kindly joining us today to present her new book, Home Care Fault Lines, Understanding Tensions and Creating Alliances. So Cynthia is Professor of Sociology at Toronto, and her research examines inequalities of gender, work and migration, and collective efforts to resist those inequalities. Her research includes in-depth case studies of precarious migrant workers and analyses of insecure labour markets in Canada and the US. So I first met Cynthia through our collaboration on a conference on migration and care labour, which led us to work on a book related to that theme alongside other contributors. And Cynthia's recently published book, which she'll be presenting today, brings together her important research in this field, which is indeed a major contribution to understanding not only the intersecting inequalities of care, but the potential for alliances between people providing care and those in need of care services. So it addresses, on the one hand, the dynamics that exacerbate tensions between older and disabled people's quest for flexible care services, and on the other, care workers' pursuit of security. It grapples, I think, with long-standing issues in the provision of care, but is very timely in the context of the COVID-19 pandemic, which has fundamentally revealed the failings of our care systems on multiple levels. Those tensions and alliances that Cynthia investigates in home care critically engage with the failings of care systems as regards both security in work and security in care. And I'm interested also to engage with see what Cynthia's reflections are on the ways forward. So thank you very much, Cynthia.
Thank you so much for that introduction, Isabel, and it's nice to see you again. Thank you for inviting me to share my work in your seminar today. Can everyone hear me okay? This is my first hybrid presentation, and so I'm not sure where to look. But I'm going to go ahead and share my screen. Okay. Okay. Can folks see my screen?
Yep.
Yep. Okay. Okay. So I like to think about home care as a window into the complexity of inequalities, but it also sheds light, I think, on the potential for challenging inequalities. So in my recently published book by Cornell University's ILR Press, I argue that in home care, understanding both tensions and the possibilities for alliances is essential. Now, several studies have argued that alliances between home care workers on the one hand and older or disabled people who receive home care on the other are key to achieving both quality care and quality work. Yet my research shows that we also need to recognize and mediate tensions if alliances are going to be able to tackle structural fault lines reflecting complex inequalities. So how can we arrange home care then to minimize tensions and maximize the potential for alliances? I answer this question in the book by comparing how 4 government-funded programs differ in the way they organize home care. I focus on the most personal in-home support, so that's help with daily activities like bathing and eating. So what I want to do in this talk is give an overview of my argument in the book and a peek at 2 of the 4 case studies. If I have time, I might say a few words about how tensions have been exacerbated by COVID, or we can talk about that in the Q&A if people are interested. Okay, so in the book, I use intersectional analysis and scholarship on care labor, domestic work, aging, and disability in order to analyze how people who provide and receive home care are marginalized differently, shaping unique experiences and interests. So they're located differently within various axes of oppression that form a complex matrix, to use Patricia Hill Collins' concepts. Older and disabled people face marginalization vis-a-vis a state and society that values independence and devalues any form of dependence. Some people that I interviewed for the book had been in care institutions that cast them wholly as dependents. Others feared going into them. Still others lacked adequately funded support at home, resulting in their reliance on insufficient family help. So in this context, older and disabled people desire flexible services to fit their varying needs, and they seek dignity. Home care workers experience a different face of oppression, if we want to use Iris Marion Young's terms, one defined by devaluation and lack of recognition within class and gender inequalities. While most of the workers are women, there are some men who work in disability support services in my cases. The majority of home care workers, however, in urban areas of rich countries are immigrant women from poor countries. And in these contexts, racialization through nationality, language, accent, religion, culture, or skin color infuses their economic insecurity. So workers thus seek both fair employment contracts and respect. So juxtaposing the experiences of older and disabled people on the one hand and workers on the other, I consider how a tension between flexibility and security potentially exists, theoretically exists, sometimes actually exists across home care programs. Yet my comparative analysis of these 4 programs reveals dynamics that exacerbate or alleviate tensions, and the study was designed to analyze that. So let me just give you my argument, more empirical argument in a nutshell in relation to some of the care work literature. So I join many others who find that government funding based on a narrow medical definition of need, coupled with the delivery of care through a market logic, encourages employers to hire workers on precarious contracts. And these narrow funding and market logic in turn reinforce gendered and racialized labor market inequalities. This represents continuity with long-standing racialized and gendered divisions of care labor, as Evelyn Nakano-Glenn has argued. This racialized and gendered precarious employment also threatens the quality of services for older and disabled people. So building on this scholarship, my analysis reveals how narrow funding dovetails with gendered and racialized marketization to either erase traditional employers altogether or to discourage employers who are present from mediating tensions in the more micro level of what, sociology of work scholars call the labor process, right? These relationships with workers and service users or receivers, and sometimes management when they're there. These are tensions about what is done, when it's done, how it's done. Narrow funding coupled with marketization also makes collective action difficult, thus requiring innovative alliances between social movements, labor movements, or labor organizations that represent workers, and also movements or organizations that represent service users or receivers. I also show in my comparative analysis, though, how a broader social funding model coupled with nonprofit service delivery encourages more employer interventions to mediate these tensions in the labor process. This is in large part, and this is something I focus on in the book, because the nonprofit context with broad funding also support workers and receivers' collective representation. So there's this kind of process-oriented piece to the multi-level analysis that looks at alliances and also particularly what labor is doing and whether they ally with movements of service users, whether and how. Okay, so just a little bit now about the broader data and the case studies. So the analysis in the book rests on over 300 interviews revealing how a variety of players shape the conditions of home care in unique contexts. Over several years, comprising 4 case studies, research teams interviewed personal support workers who were paid to assist with daily activities and older and disabled adults who need this kind of assistance. We also interviewed caseworkers who assign hours of service, employers, senior disability, labor advocates, and we looked at the public documents from the programs. 2 grants from the Social Science and Humanities Research Council of Canada funded the travel, honoraria, community partnerships, and research assistance that made these case studies possible over the years. So 3 of the case studies are in Toronto, while 1 is in Los Angeles, and together they cover elder care and disability support. So I just want to say a little bit about the case studies, since I'm only going to talk about 2 in depth. So the first one is a case of individualized and direct funding. And so similar to your direct payments that you have there in the UK, direct funding program in Toronto serves people with physical disabilities only. Funding here is shaped by a social independent living model of disability, which emphasizes non-medical assistance with a wide range of daily activities. The workers are employees of individual self-managers, and they are called personal attendants, to use the program terminology. The funding is universal in that it's not means tested, although the Federal Canada Health Act does not guarantee personal support at home. It leaves it up to provincial discretion, so provinces can decide how much to fund, whether to fund. Okay, so the second case in Los Angeles, in-home supportive services, is also shaped by the social independent living model, even though the majority of people receiving it are older people. This is a means-tested program in the context of the United States, funded by Medicaid. Here, the independent living model combines with a family model in sort of a hybrid, in that people can pay even close family members to be their providers. Usually they pay their children or sometimes grandchildren, which is not permitted in my other cases. Here, the consumers, as they're called, are the hiring and firing employers, but the state pays the workers. So it's sort of a hybrid. It's individualized, but the state is also the employer at a different level of analysis. Attendant services in Toronto provides assistance to physically disabled non-older people who direct workers to help them with routine daily activities. Again, it's guided by the social independent living model, like direct funding and IHSS. But unlike direct funding and IHSS, attendant services are delivered through agencies. The agencies are the employers. And here, all the agencies are non-profit. So this is an example of a contract agency model. Sometimes these service users are called clients, given the formalization of independent living philosophy and agency-based social services. Sometimes they're called consumers, along the lines of the independent living model and movement. Finally, home care in Toronto provides long-term care to older and chronically ill people, as well as home health care for those recovering from acute illnesses. So here, government funding is based on a medical model that prioritizes acute over long-term care needs. So I'm focusing on the long-term care population, but within an acute care model. People here are called clients, and personal support workers or PSWs. Here, housework is means tested, but other services are not. Indeed, housework especially is equated with family work, but family here are not, cannot be paid to be providers. Another difference in these contract agency models, which I'm going to focus on today in my talk, is that most of the agencies in the home care program are for-profit. So when I speak of home care generally, like in the title of the book, I'm talking about all of these cases and others in the literature of state-funded assistance with daily non-medical activities provided to older and disabled people in their homes. Okay, so what I want to do now is just give you some highlights from the home care and attendant services cases. All right, so first I want to talk about home care. This case illustrates the classic trade-off noted in the work literature between flexibility for employers and insecurity for workers. Here, flexibility also accrues to the government, but not the clients. So that's the general argument of this chapter. I want to give you a little bit of background to the context first, and then I'll go into flexibility, talking more in depth about flexibility and security. So in the mid-90s, the federal government cut payments to the provinces, and Ontario, which is the province where Toronto is, restructured its home care program, introducing what was called managed competition, allowing for-profit companies to compete with longstanding nonprofits for service provision contracts. The Ontario Ministry of Health and Long-Term Care funds these services within a medical model, as I said, premised on cure as opposed to long-term care or chronic illness. The government justified this move to manage competition by claiming it would provide consumer choice and efficiency in their documents. This is the language they used, but the effort to contain healthcare costs by closing some hospitals and transferring more medical care to home care also drove this restructuring. In the late 90s, the government rationed in-home long-term care even further by giving more priority to acute patients. And in this context, one agency manager said, the average client is getting 2 hours of service in a week, which is very, very limited. And a huge number of clients actually only get 1 hour of service. In reference to her single bath a week, Alice bitterly said, it's disgusting. Many people we interviewed had experienced a cutback in services, especially for housework, since it had shifted to a means-tested service. Family could not fill in all the personal support and housework gaps, since women who do the majority of unpaid work are employed or looking after children or both. So the government is funding home care here, but distancing itself from responsibilities to workers by contracting services to agencies, increasingly for-profit ones. As in other contract agency models, a legal employer is the agency that hires the workers and sends them to clients' homes, but the state funder also influences the employment conditions, of course, through the level and model of funding. In the late 2000s, the government put this managed competition system on hold. And in 2013, it abandoned it, in part due to critique by unions, by nonprofit providers, and by academics. However, what I found doing this research is that the workers' lives were still shaped by the system in large part through its negative impact on their collective representation. The government disbanded the voluntary board of directors that managed the earlier home care funding and replaced it with government-appointed executive directors and boards of directors, severely reducing input from clients. Contracting out also made it difficult to unionize because labor legislation, as based on a post-World War II factory that assumes a standard employment relationship, a direct and continuous relationship with a single employer, which is at odds with the competitive contracting model. Several of the nonprofit agencies that had lost contracts during managed competition were unionized, and most of the ones who gained them were non-unionized, the for-profits. A lack of significant union presence in this sector, coupled with next to no collective representation for the clients, shaped worker insecurity and also limited clients' flexibility. So at the labor market level, the flexibility mostly accrued to the agencies and to the government, who were able to distance themselves from responsibility. And by labor market flexibility, what I mean here is the ability to decide and change who provides services. This kind of flexibility did not accrue to the clients. So home care clients, they didn't hire their own workers, as I said, and agencies did not accommodate the client's personal preferences in the initial assignment of workers. However, in non-unionized agencies, which are now the majority, the clients were sometimes able to switch workers based on highly subjective criteria. Nevertheless, the degree of clients' flexibility to choose who provided their services was contingent both on the type of agency, whether it was unionized or not, nonprofit or not, but also on the social location of the client. So men or women who were young, who were white, who were born in Canada, who had class privilege, or some of these combined, were most commonly the ones who would ask for a switch in worker, right? So it was complaint-based. And for-profit non-unionized companies were more likely to accommodate this request. So for example, Gerald, a white man born in Canada in his early 60s that we interviewed, told the manager about previous issues with workers and said about the new one, "I hope he's got a personality." In response, the scheduling coordinator told him if he wasn't happy with the worker to call them. In contrast, Agatha, an older Jewish immigrant woman, said that the non-union for-profit company had never asked her about the workers, adding money talks and I have no money. So in short, even for-profit non-unionized companies did not offer flexibility to most clients, only to those who complained the loudest. So within a context of rationed state funding, the agencies tried to preserve their own flexibility and meet the requests of select clients who complained by defining workers as casual, right? For-profit non-unionized agencies were the most extreme here. They classified workers under this category called elect to work, which in the Minimum Standards, Employment Standards Act is akin to a self-employed contractor, or they classified them as casual or 100% part-time. These managers argued that classifying workers as casual and part-time was necessary to provide scheduling flexibility for clients. They also claimed it provided choice to workers, but interviews with workers and clients illuminated a different dynamic. And particularly interviews with the workers illuminated the negative implications of that choice, which translated into insecurity. So when we asked workers whether they were assigned another client, if they lost one for any reason, they explained that this was far from guaranteed. Client comments like maybe, they try, it depends, and others conveying contingency were common among the workers' description of the implications of losing a client. So Wenna summed up this precarity well when she said that waiting to get a client with equivalent hours could be a day, could be a year. Employment security combined with insecurity in wages and benefits, which in turn exacerbated these contingent connections between workers and clients. Notably, home care PSWs earned much less than PSWs in nursing homes and hospitals. A recent study by the Ontario Community Support Association, which represents the nonprofit home care and community support service providers, found that 19% wage gap between workers in home care and in the hospital sector, which works out to about $11 Canadian dollars an hour. And there are similar differences across Canada. So those classified as casual are also not fully covered by the basic floor established by the Employment Standards Act. So they don't receive things like paid holidays, vacation, severance pay, and sick pay. Which is especially important in today's context. Can you hear me okay?
Yeah.
Yeah, okay. So in each of the case studies, I examined flexibility for service users and security for workers in the labor process, as well as the labor market. So tensions in the labor process concern what services are provided, when, and how. So I want to illustrate just one tension I identified in the broader comparative analysis. And this one I call the tension between time and task. This is a tension between people's need for help with a range of changing activities at various times versus a defined kind of job description at a stable time, often desired by workers. So the government's rationed funding influenced the ways that the agencies formally and informally approached this tension, this time versus task tension. And this shaped how the PSWs and the clients were tried to negotiate flexibility and security at this level. Managers described objective rules regarding what was done. And they explained that in the contract with the government, they were only allowed to provide certain services such as personal care, bathing, assistance with mobility. We're not there as a homemaking service, they said. PSWs could provide light housekeeping, but the government defined this as the worker cleaning up sort of the immediate area affected by the personal care. So mopping the bathroom floor after helping with the bath so the client doesn't slip, for example. But this definition of actual, in practice, what is light housekeeping, what is heavy housekeeping? It's very subjective. But managers spoke of the care plan as an objective guide to what was to be done, but they didn't enforce the care plan. They didn't support workers in interpreting the care plan or negotiating tensions around it. So for example, referring to the workers, one manager said, sometimes they don't feel comfortable advocating for themselves or to say no. I mean, there's a lot of that. It's so hard because it's community-based. We try to monitor them, but how can we really monitor? So other managers likewise explained away their lack of intervention with reference to a self-sacrificial, usually woman worker, and the difficulty of monitoring home-based services. So rather than proactively supporting workers or clients, they addressed problems ad hoc, or more commonly, they left it up to workers and clients to negotiate one-on-one. In contrast to this official definition of the services as a set of discrete tasks, it doesn't include very much housework. Home care clients wanted and needed flexible support to fit with their changing needs. So for example, Eleanor, who was in her 70s and had osteoarthritis and had experienced multiple bone fractures, said that the home care worker helped her mostly around the house because she wanted to, quote, persevere and take a bit longer to do her own bath and her own cooking. So the workers changed the sheets on her bed and did other laundry, cleaned her bathroom, and if she had any time over, she might dust or something, Eleanor said. So justifying this allocation of tasks based on need, knowing that housework wasn't really part of the job anymore, Eleanor insisted, I consider what she's doing for me to be personal care. A few clients admitted that workers stayed over paid time, which is a finding we find throughout the literature, including a recent book I'm reading now by Hayes on the UK context about unpaid overtime, staying over your paid time. So a few clients admitted this. So for example, Claire, a 51-year-old who had incontinence, difficulties walking, and mental health issues, said, you know, she will stay an extra half hour, 45 minutes, and she doesn't get paid. But the difficulty I have in trying to get my laundry, I mean, there's just no way I can vacuum. So Claire, like most clients we interviewed, was grateful for the workers' unpaid help rather than, you know, expecting it or even asking for it. Nearly all the workers spoke of providing some services as a favor or of giving a little extra to some clients some of the time. But I want to emphasize that unlike I've seen in the literature, the workers we were interviewing were kind of pushed to the limits, and they were starting to rescind these favors, right? The vast majority gave examples of staying over their scheduled time, you know, some of the time, but also talked about not staying overtime or not doing extra for other clients. So in this context of state sanctioned and agency condoned economy of favors, workers did extra for some, but not others. So for example, Tala said that she stayed over her paid time initially when she was first hired in order to pacify upset clients, because she said, you can't just leave them. And she said, compassion sometimes has a tricky way. But by the time we interviewed her, Tala was adamant that workers should tell their supervisors if the client consistently didn't want body care and asked instead for housework. Because otherwise, if you did that, if you did the housework, they're going to ask for you to do it again, and they couldn't possibly meet all this need. So this gendered economy of favors was under strain. Not only due to ration funding, but also due to racialization in the broader labor market. The majority of clients we interviewed were white, with many born in Canada, while most of the workers were immigrants from a range of countries in Asia, Africa, the Caribbean, and Latin America, and some from Eastern Europe. And these demographics fit with the Greater Toronto population. Some workers of color recounted overt direct rejection from white clients or racial slurs. Many more experienced being treated like a maid. So for example, Tanis said, quote, some people never have had a Black person come into their home. Some asked her to clean because they did not want her to touch them. They might flinch when I go to touch them, she said. They might pull away. But yet she insisted on respect, saying, you know, we are only human. So the expectation of cleaning when it was no longer part of the job, even if it stems from a place of desiring flexibility and preserving one's independence, was clearly a racialized experience. So the other question I ask in this chapter and all of the chapters, can collective representation or voice offer an alternative to these tensions? So if unions are to if unions are to improve worker conditions in this kind of contract model, they need to reject a narrow business unionism focused only on kind of workers' issues at a prototypical factory workplace, in favor of what's called in the literature a more social unionism that links economic and social justice issues in the political realm. This is often achieved through alliances between labor and social movements representing the clients or service users. And I just want to sort of briefly talk about how in this model, the union, which is the Service Employees International Union, so the power of union was significantly eroded through this managed competition, but the SEIU is there trying to organize, and they've tried to push for labor market security by linking the contract employer to the state and arguing for things like travel pay and increased wages and benefits. And they've had some success there, but there haven't been much alliances with client groups, and that's limited their success. But the workers have recognized that they're trying to improve labor market security, and they praised the union for this effort. However, at the labor process level, there's this legacy of business unionism where the union doesn't have a strategy to tackle these tensions. They don't know how to engage with the clients. They talk about a bureaucratic grievance process that just doesn't work, but they don't have an alternative. And so we have some success, but not at the labor process level. And this contrasts with workers' extensive description of these tensions at the labor process level. And this sort of led workers to also critique their union, or non-unionized workers to critique unionization in general. So, but what I want to do now is turn to the second case where the attendant services case, where I argue that there is potential for workers and people receiving services to what I call bargain over security with some flexibility. And so just moving to the Ontario Attendant Services case, as I said, this is sort of organized by a social independent living model, which has a very broad view of what independent living services are. And it's also better funded by the government. It's not as rationed. And so among the consumers we interviewed, most received over 20 hours of pre-booked services a week, and several were close to the maximum, which was nearly double that. So quite a difference. Also, as I mentioned, all of the agencies are nonprofit, and there wasn't this managed competition. Okay, and so this then facilitates collective representation for both attendants and consumers, as they're called here. Most of the agencies in this sector were unionized, and only all but one in my sample was unionized, and they were represented by Local 40 of Unifor, which is a general union. But this local has a history of organizing precarious workers in the garment industry, for example. All but one agency also in my sample has consumer representation on its board of directors, while several also had additional committees or more informal groups and meetings in which consumers could give input. So how does this different context shape flexibility and security? So at the labor market level, in terms of having choice and say and ability to change who provided your services, the consumers actually had little or limited flexibility. The managers, however, recognized this conflict between consumer flexibility and attendance security, and talked about how a key part of their job was about problem solving around this tension. So one manager said, I love doing it because I love doing this job because it's all about problem solving. The consumer has responsibilities under our contract. One of their responsibilities is to come to the table and try to resolve issues. It's their home. If they say, I will not have Bill in my home, that's their business. But that doesn't exclude our responsibilities to gainfully employ Bill. Let's say Bill was a full-time staff person and the portion of his 12-hour shift is there because of John. Guess what? If John doesn't, and John refuses to have Bill come in, guess what? If John doesn't come to the table and find some solution, then John is effectively saying, I'm canceling my services whenever Bill is in. So in attendance services, as this quote relays, full-time workers, there are some full-time workers. Most of the workers are part-time, but they're part-time permanent. They have guaranteed hours. And so given this worker security, the managers in this model viewed conflict resolution as key part to this job. So this really contrasts with the home care managers who would give flexibility to clients who felt entitled to complain the loudest, otherwise leaving it up to workers and clients to negotiate tensions as individuals. In addition, even though they didn't have influence on who was assigned to them, there was input initially into hiring in most of the agencies. Sometimes they sat on hiring committees with management. Sometimes they were asked more informally and infrequently to attend an interview and give their views on whether they thought the candidate would be suitable for this kind of work. During the workers' 3-month probation period, the consumers were generally surveyed about new attendance. After the 3-month probation period, however, firing had to show significant cause given protections in Ontario's Employment Standards Act, which the union enforced through a collective agreement. So interviews with consumers revealed the prevalence of this conflict resolution over switching workers. So one consumer, who I call Ryan, said, you know, if you're not comfortable because you don't feel safe, you don't feel comfortable in terms of personality, the way they're following your directions, you talk to the coordinator and it's determined at that level whether you have a valid issue. And, you know, in many cases, they try to do some conflict resolution. Not that they didn't have a mechanism to talk to managers about issues, but it wasn't ad hoc, let's just switch because you complained, let's get to the root of it and have you come to both sides come to the table. This limited labor market flexibility coupled with conflict resolution supported workers' security at this labor market level, job security. So for instance, Zoe recounted a consumer with very complex care who initially refused to allow her to be trained to provide the care. This made Zoe feel, quote, inadequate at her job. But the consumer's flexibility was only temporary. Zoe explained that one day there was no other available worker. The consumer had no choice but to accept Zoe. And she felt that from that day on, I think she saw me differently, thinking that, okay, yeah, she knows what she's doing. She's capable. She can handle her job. So this worker security was also sort of mediated by the manager, right? To make it only the temporary complaint, to have the worker trained nevertheless, and to eventually place the worker. And wages and benefits are much better in this model due to collective bargaining. Just a little bit about the time versus task tension in this model. What I end up arguing is that these managers have crafted a task flexibility policy. So most managers had this really broad interpretation of the job of independent living as help with anything, you know, an able-bodied person would need help with, including help with housework for adult able-bodied people who came to visit or children who lived there. But they facilitated compromises between attendants and consumers on the parameters. So one employer said, you know, if somebody came to visit an able-bodied family member, we would help with housework, but they also had to be doing something, and all that would have to be negotiated through me. The consumers felt that this time over task or task flexibility policy was really important. And they talked about referring to it, right? So for example, Ethan said, you know, sometimes attendants resisted. He said, let's say I want to clean up one day. You know, he might say, I'm not here to clean up, and ask when weekly housekeeping comes. But Ethan asserted his right to flexible help with cleaning when he needed it. But wait, it's my booking. In my booking, I can do whatever I want. I tell them to read the job description again, or I say I'll call the supervisor and then they'll change. So Ethan still has to negotiate. This is in his home, right? But he has this task flexibility policy to refer to. He could call a manager if necessary. Also, we have consumer representation on the board of directors. And one board member, Gord, explained how there are these written descriptions of the task that the consumer normally wants, that the consumer has to find that, you know, in the mornings on these days, I want my shower routine. But they're able to change that, right? But sometimes worker will see these descriptions and they'll want it to be followed to a T, Gord said. So through the board, the consumers were working on just getting these descriptions taken out of the bookings altogether to just convey this task flexibility policy. Supervisors were pushed to broker these compromises, not just by the board, but also the union. One union official described struggles with consumers over what the job entailed as an issue of respect and dignity in the workplace. that pushed the workers to unionize in the first place. What is the balance between independent living and servitude? And we talked quite a lot about this and how the union had negotiated even sort of a pet care policy and lots of parameters around what the job entails. In this context, most of the workers in this unionized context consented to this flexibility policy, and they contrasted their job with a standardized kind of care plan and set of tasks. So when we asked, can they change, can they ask you to do housework instead of personal care if you come in? She says, they do have their housekeepers, but there's a bit of sweeping or washing of the floors. Again, you've got your time. As long as you're not over your time, you get it done, it's fine. So like Tina, who was born in the Caribbean, other immigrant workers of color, drew boundaries around personal care to separate it from servitude, but they had this backing of the union that allowed them to negotiate. And in that context, they consented to a fairly flexible policy. So here we have a stronger union that has provided security not only at the labor market level, but also in the labor process. At the labor market level, these are all nonprofit contractors, and there was some effort of the union to try to ally with them to pressure and lobby the government to increase funding. There was also this effort, which you don't see in the literature very much, and you don't see in my other case, to actively organize the consumers to support the union, especially during strikes or during unionization drives, right? So initially, John says that the consumers, thought we were striking them, right? But we explained it's not them, it's the government, it's the agency. And then they came around and they started to understand and they started to support. There are limits though at the labor process level still. And the union is still operating within an industrial labor relations regime where the tools are to target the legal employer, which is the agency, even though they recognize that the consumer is a de facto employer. So with these tensions that don't so easily link to the funding model or to the contract agency organization of work, these tensions in the labor process like sexual harassment, subtle racialization or not so subtle racial discrimination and slurs and rejection, they recognized that these happen and they attempted to address it. They had this resisting abuse course for the workers. They had mandatory human rights and anti-harassment training for the managers and the workers, but they weren't able to require the consumers to take these courses. They tried to get the agency to require them to take it, but the agency said, we can't require it, we can suggest it. So there are limits. And in fact, all four of my cases, none of them really achieve this flexibility at both the labor market and the labor process level. So what I do in the conclusion, which I want to do in my concluding time, is to think about how can we achieve, if the goal is flexibility and security, or we might say quality care and quality work, how do we balance these tensions, recognize the tensions, yet balance them? So home care brings together the worlds of labor and social services, complexly interlocking inequalities of race, class, and gender with those of age and disability that are experienced differently by workers and people in need. So I sort of try to chart the potential for flexibility with security through comparative analysis of my cases, but also in dialogue with other cases and some on the ground practices. And I end up arguing that the workers and the clients or consumers or service users need what I call an intimate community unionism. And this would kind of at the center of this is a democratic kind of alliances between labor and groups of older and disabled people that would address tensions at the labor process level and more structural fault lines at the labor market and state levels. So the first kind of prong here is a universal social funding model. Many have talked about the need for universal funding of personal support, and this has gained more traction after COVID-19. At least in Canada and mostly around long-term care homes, but there's some discussion for home care as well. I draw also on the lessons in this comparison between the medical model and the independent living model that I talked to you about today, to not just talk about more funding, but what should be funded, right? We need to fund housework. We need to fund emotion work. We need to fund the body work as well, of course. So we need a broader definition of what personal care is. So the second prong, though, is about labor market intermediaries. And so the cases that, the contrasts that I showed you today really show the problems when agencies, for-profit agencies, act pretty much like temp agencies, right? Making a profit off of placing people, very little training and management. That for nonprofit agencies are better at balancing flexibility and security. And in the other two cases that I didn't talk to you about today, the service users are actually the direct hiring employers, and their needs are more intermittent. So we really need new forms of labor market intermediaries that connect workers to multiple jobs and link people in need with multiple workers, right? They need to be nonprofit. I also argue they need to be culturally sensitive. And by this, I mean sensitive to the different populations of service users. Younger people with disabilities are very different than older people with dementia, for example, but also culturally sensitive in terms of immigrant seniors, for example. So some research, one of the case studies looks at the Filipina community in Los Angeles. And I have other research looking at Chinese immigrant seniors and Korean immigrant seniors, where they need workers who speak their language. So both the workers and the service users need to be able to have input into these labor market intermediaries so that they meet their needs. The labor market intermediaries need to be publicly funded because some of these grassroots community organizations that are hosting them really don't have the resources to say, keep the registry up to date. So they're less useful and people don't use them. They fall back on their own personal networks. But if we want to make sure that all these tensions are not simply displaced to the labor market through firing or quitting, we need this third piece of somehow thinking through how we can negotiate support workers and clients or service users or consumers to negotiate and these tensions at the labor process level. First, we have to recognize they're there, and talking about them might undermine sometimes the alliances necessary to push the state for universal funding, to push for these labor market intermediaries, but they don't go away, right? They just get displaced and they recirculate. So in the book, I look at some innovative practices among the domestic workers movement in the US, for example, to think about how they're starting to think about anti-racism, anti-ableism, these kinds of consciousness raising almost, and sort of educational pieces that can help to negotiate some of these tensions. In the end, given the bureaucratic tendency of the most innovative unions, I look to these community-based labor organizing examples, but also to what unions are doing, especially the feminist ones focusing on leadership development and trying to kind of grapple with these complexities of inequalities in care. But in the end, the comparative analysis really shows how democratic alliances between home care users and workers and their organizations and movements and allies are really what is key, right? That they're involved in designing the labor market intermediaries, in thinking about what needs to be funding, and in talking to us about the tensions and how we can sort of overcome them, or not overcome them completely, but manage them and mediate them. So I should stop there. I think I'm actually over my time. Thanks for listening.
Thank you very much, Cynthia. That was a fascinating presentation of your book. I will hand over now to everyone on Zoom and those of us in the room for questions. Those of you on Zoom, if you want to raise your hands or indeed post a question in the chat. Anybody wants to raise their hands in the room here?
Coretta Phillips maybe has a hand. Oh, that's a clap. I'm sorry.
Lucinda has a question.
Thank you.
Thanks very much. That was really interesting, and I was thinking about these tensions, and I was wondering, there was one that perhaps you didn't occurred to me that maybe further complicates it, that I wondered if you could comment on a little bit, which is about thinking about the client worker relationship, but the client is often the person who's not the recipient of the care. I mean that might be a relative, so where the consumer or the client has got learning disabilities or is elderly and is no longer managed, and they might, in some of these areas, they might be different, or they might have different expectations, or one might be more problematic in terms of sort of racial exclusion than the other. Or I wondered if you could just comment on that a bit, and what you thought the issues were there and what you thought potential solutions were as well. Maybe it's the same solutions, but.
Yeah, thank you. Thank you for the question. So I didn't focus on folks with developmental or intellectual or psychiatric disabilities, largely because of the consent process, but I can sort of elaborate a little bit from what I do know. There's a couple, and also the missing actor here, you're right, is the family, when the family is not also the client. And so even in my cases, so to elaborate from what I did study, even in the cases where the client is the receiver, in several cases, and they were all older men. When we went to do the interview, the man was like, well, we'll have my wife sit in, and the wife answered all the questions, right? And the man really deferred to her, especially all the questions about managing the care, and not, she does that. And so there's a large literature on that of women who manage the care and interact with the paid care worker, right? And so often, sometimes the man would say, we decided this, and the woman who was in the interview, the wife, would say, and then she would elaborate that we was like her and the worker negotiating and getting him to take the bath. So there certainly is that actor. And in the home care in particular, we noticed during the research, actually one of my research assistants said that, we're talking to them about their services, but the worker is there for 1 hour a week or two. And the rest of the time it's the wife, right? And so we didn't have the funding to kind of include the wife. And initially I actually excluded the family members, thinking there's a lot of research on this in the care literature on the unpaid work. But in retrospect, it would have been better to include it. So we included it in these few cases where it was brought up, right? But in the disability model, in at least the case of attendant services that I shared with you today, but the other direct funding one, which is like your direct payments, people largely didn't live with family. In fact, they wanted to not live with family, and these supports allowed them to not rely on family. So in that case, it was more direct with the worker. In the direct funding, yeah.
I was thinking explicitly of cases where they weren't living with family, but where, say, an adult child is
managing,
is kind of, or semi-managing, or maybe wanting slightly different things to the person who's actually, wanting them to have a bath and they want to have housework. How?
Right. Yeah.
But somebody out, not necessarily an unpaid care in the home, but somebody who's managing that care. I just wondered whether that was something. But it sounds like
I think with the older people, definitely there's the potential for that tension, even though I didn't interview the adult family members. When it came up for me, it was the wives who were there in the interview. But I would say with the disability groups, even though they weren't living there, there was a really strong sense that I don't want to rely on family, partly because, and they had in the past, right? And so that was part of the effort to be independent. In the Filipina case study, just to, I only said briefly, but people can pay their providers, their daughters-in-law, and not just in the Filipina community, but in that whole IHSS case study. So that's another dynamic. That sometimes one of the tensions there was that the son would be receiving the money from the state as the provider, but the daughter-in-law would be doing the work. So there was kind of subcontracting within the family And there was also subcontracting to relatives who didn't have papers. So the person on paper as the provider, this is in the context of LA, would be, say, the son, but then a cousin who recently arrived who didn't have papers would be doing the work. So there were some tensions there, and there was a real family economy. If one person got a job, a better job, then another family member would then do the work, but almost always like the son or sometimes the daughter was the one on paper. So that's another tension that you weren't thinking about, but it's definitely these other actors who didn't always live in the household. So thank you for the questions. Yeah.
Tim?
Thanks, Isabel. Thanks so much, Cynthia. That was really interesting. I guess I mean, I don't mean to be crude here, but you know, the two stories that I heard one seemed to work. The first one didn't seem to work. The second one seemed to work. Or one worked better than the other. And you know, and maybe this isn't quite so much what your research was about, but I'm curious, especially thinking about how a story that you're telling is about, you know, at least looking to the future, like what can activists, social movements, you know, users, et cetera, do together to affect change? I guess I'm curious to know, like, why did these systems develop in the way that they did? Why in a place like Toronto, which is, yes, a big city, but to have like what sounds to be pretty vastly different ways of dealing with home care, why such different trajectories? And, you know, thinking about the first case, you noted that there was that pretty big shift, or at least the abandonment of the managed competition model. You know, was that abandonment of that model the result of social activism? Was there, you know, recognition amongst government officials that it wasn't working? I guess I'm trying to just get a sense of what change has there been thus far to understand what could be possible in the future.
Mm-hmm. Yeah, that's a really good question. So you're right. I mean, I don't want to hold up one model as everything is working here, but the contrast I made, certainly one was working better than the other. And the key dynamics that I point to is the less competitive model, even though it's still a contract model, less competitive with nonprofits, which also interacts with unionization. So that's the other piece. So in terms of why they developed in the way that they did. So one, I think the biggest critique of the comparison that I presented to you today is that they serve different populations of service users, right? And so the one serves younger people with physical disabilities, the second one. And so those services developed in the 1970s as independent living services. And I don't know how much people know about the independent living movement, but it's, you know, it's in Britain as well, right? But, you know, kind of the stories started in Berkeley, but it's that movement has influenced the Canadian independent living movement. But in Canada, they use the language of consumers, but they're also talking about choice and choice within the state-funded services, whereas in California it was privately funded services, usually more directly with the market. But that kind of independent living philosophy, even some of the language of, you know, workers are our arms and legs, they're the extension of us, right? But also this broad notion of what kind of services we need, that influenced these, you know, the attendant services model that I talked to you about, right? And the executive, these are very small organizations. You know, and the Hayes book I'm reading refers to these independent living charities. So they're like that. There's a couple of large ones, but most of them are small. So there's a certain philosophy there. And also because it's not part of the general acute system where you have the long-term frail elderly are inside this medical model of the first model, where you have these pressures on the hospital that, well, they're interpreted in a neoliberal kind of approach as pressures that we need to cut costs. So there was this push to, you know, send home somebody early after a surgery, So those acute patients were getting the priority in that home care model, and the long-term frail elderly were getting their hours cut back. And so those, and that drove the managed competition. So that wasn't happening in the independent living model, which is more premised on a long-term care model. So that's one difference. With the second change, so why did they develop in the way that they did? The independent living model is behind one, and the other is part of like a different healthcare system that doesn't have these broad philosophies. So that's why in my look at, universal funding, I'm trying to think of what lessons can we learn from this social care model, this independent living model, and take that into the challenging the medical model. In terms of why the managed competition was abandoned, the nonprofit organizations and unions did a lot of research and did a lot of sort of allying together and a lot of public pressure to criticize the managed competition and to try to link it to turnover of workers and link it to declining quality of care for the service providers, and also a lot of academics who did that early research. And that is one of the reasons why they initially put it on hold. But then you have these for-profits that are like frozen in history. So it put it on hold, and eventually they abandoned it. But it doesn't mean for-profits aren't still involved. It just means the competition process is not as, the contracts aren't as short term, and it's not as competitive. There's more stability, and that's allowed unions to come in and start to reorganize the sector, which is another dynamic that I really want to emphasize, that the union presence in both of the contexts really matters. I hope that answered some of your questions.
Yeah, thanks.
Okay.
Any other questions from anyone on Zoom or with us in the room? If not, then I'll take the opportunity to ask a question, if I may, Cynthia.
Sure.
So I'm really interested in the way in which you really dig beneath the surface in revealing the kind of complexities, both of different models of care, and then of course different funding models, and how that translates into different relationships between providers, intermediaries, clients, workers, and so on. And I'm interested in how you engage with collective action, and specifically unionism in this context. And of course, what's difficult about home care is it's a really difficult sector to unionize. We're dealing with workers who, as you've revealed in your presentation, are often extremely and very much invisibilized in terms of working not in sort of organizations, but in the homes of people. They're very much the workers who have very sort of precarious working lives, potentially working lives that change from day to day in terms of the number of hours of work they have, and so on. And I just wondered if you could say a bit more about, firstly, the sort of difficulties of trying to organize workers, and also to organize workers alongside their so-called clients, who are also in a kind of particularly precarious situation, and the extent to which unionization and collective demands, both by workers and by clients, translates to fundamentally to improvements in funding. Because I suppose what the other sort of point you illustrated is the importance of essentially universal funding, and the importance of essentially tackling the fundamental underfunding and undervaluing care. Mm-hmm. So I was just wondering if you could, I suppose it's, to what extent are the two related? How do people organise? What are the difficulties there? To what extent does that affect change in relation to funding?
Mm-hmm. Those are great questions, and really central to what I'm trying to get at is, so I kind of maybe said less about how the Alliance can push for better funding, because one of a lot of the literature has focused on that, and I want to look at these tensions. I don't want us to ignore these tensions of the labor process, partly because that when you talk to workers, that's what they talk about. They also talk obviously about the lack of job or any kind of job security or employment security or income security. So I kind of emphasize that, but I also am influenced, like why do I have also this one Los Angeles case? So it's not your traditional comparative analysis where a few variables are different and I hone in on the ones that, you know, I control various variables and then I hone in on the ones that change, and that's the driving factor. It's a more ethnographic studies I did over the period. But the reason why I chose LA, not only because I'm originally from there and I know a lot about the context and I've seen it, but also because there was this really innovative model where the SEIU organized for 10 years to try to ally with the independent living movement. There were a lot of tensions. SEIU also represents workers in nursing homes, and the independent living movement are trying to literally shut down the nursing homes, like protests outside. And so how can these groups ally? So they decided that it had got so bad in Los Angeles with turnover, with every year when there was, back to the funding question, when there were budget cuts, when there was a budget every couple of years, the California state budget, because there's some of it is federally funded, but a good portion is state funded. There would be threats to cut back. They could never move forward because it was always like, we're going to cut back the family providers. You're not going to be able to pay family anymore because the federal government doesn't cover that. Or we're going to take away the benefits that you have, right? And so in many ways, this social movement that allied between the alliance between SEIU and the independent living movement and some seniors organizations, but largely the independent living movement across different cities, targeting the California state government, was always focused on this funding model. But they were kind of running to stay in place because the situation, so in one way you have this innovative model in California because labor is so, had so little power that they were really innovating and using a lot of resources to ally with a movement that has very different philosophies from them on many levels, but you're in this context that is hyper neoliberal and that is based on a whole class of undocumented workers who have no rights, right? And so what I was trying to think about is imagine taking that innovation and putting it in a place like Toronto, where the union, and Toronto is also neoliberal, right? But where the union had more power, more seat at the table. There's a broader party system. There's the liberal government is more left-leaning than the Democrats in the US, plus there's a Labor Party. And so what could happen there? And so the interesting thing is that there was less alliance between labor and the disability movements and even the senior movements because they had more of a seat at the table. So one of the organizers I interviewed talked about playing, you know, we have an outside game where we have the protests in the streets and we have an inside game. But during my research, they were mostly playing the inside game because they had a liberal party, and then they had the NDP, the Labor Party, that was that also had a lot of seats. And so you know, they have had some success in halting the managed competition and increasing funding to get things like travel pay covered and benefits. And they also had success in terms of labor law and making it easier to organize. So for example, things like successor rights, which would mean that if a worker was unionized with this contract agency and the contract changed hands, that the workers would keep their union, right? And so they had some success in some also getting the elect to work designation, not being able to use the elect to work designation. So they had some success, but then we had a conservative government who eroded all of most of that and then took away sick pay and did lots of other things. So there's definitely like a political unionism that has to take place vis-a-vis the state as funder and de facto employer. But if the alliances with the recipient groups aren't strong, I don't think it's as powerful, right? So I hope that answers some of the questions. Definitely you need to make it easier for unions to organize. I think one of the things that I end up emphasizing the labor process level also, because the alliance in Los Angeles, after they won this kind of innovative model where they, in legislation, recognize multiple employers. So the state was the employer for the purposes of collective bargaining, but only collective bargaining over wages and benefits, not these kind of labor process tensions. But the recipient, the consumer, remained the employer for hiring and firing. And the county government, the local government, paid the workers. So they recognized this. It took 10 years of organizing this innovative legislation. But after that, the alliance, I mean, people maybe can't, organize all the time, right? It's time consuming and tiring, and people move on. And so the alliance kind of became weaker and less democratic, meaning people weren't listening across these divides of, you can call it flexibility or security, you can call it independent living or workers' issues. And a lot of the independent living activists that I interviewed, they said, the union's going ahead with things without working with us. They have this whole training program that is based on a medical model in the nursing homes, and they're not consulting with us. And so this is why I focus on this democratic labor community alliances. And my contrast between the two unions I talked about today, and I didn't get into, is that one is they call themselves as like grassroots social unionism. They're more participatory, workers are more active, and there's more people elected from the rank and file, whereas the SEIU is pretty top down. So it's also like, how democratic are unions in terms of participatory democracy? How democratic are these alliances in terms of like the ongoing work of listening across these divides? And that's kind of why I put that at the center, because I see in Los Angeles, they had this innovative moment and it kind of slipped away. So yeah, I hope that answered some of your questions.
Absolutely, thank you so much. It was really interesting.
Hi, Cynthia. Thanks very much for your interesting talk. I wanted to ask you something about technology. Labor process scholars in the UK seem to be obsessed with the gig economy and technological change in general. And I know that the relationship between automation or digitalization and care work is not as evident as in other sectors or industries, but I still wanted to ask you if you've seen any trends that could be related to that in your research.
That's a really great question. So I don't focus on it in this book, but a couple of things I'll say. I have a graduate student who's looking at care work in the gig economy for the dissertation and is just kind of getting started. So it's largely in Toronto in the private sector, right? But so what I would say is, if you have this hyper use of technology to classify workers as independent contractors, to erase the employer altogether and control them through these algorithms, right? And it's all based on kind of the client directly and the worker directly evaluating each other in the app, like we see in Uber and other things, that it's only going to exacerbate these flexibility, security tensions. On the other hand, however, it's not the technology necessarily itself. So in Los Angeles, I have another paper that's coming out in Gender and Society that looks at the private sector, which is the majority in Los Angeles. And it's with my colleague, Jennifer Nazareno. And it's again, looking at the Filipina community, where you have agencies where you have Filipino workers, but they're catering to white US citizens. And you have these Filipino-owned agencies who hire Filipino workers. And so there you have the agency, but you also have the Filipino Worker Center, which is not a union, but a worker center who has started a cooperative. So both because the workers are considered independent contractors and because they're largely undocumented without papers to work in the US, they have gone with this cooperative model, and the cooperative is using an app to connect workers with clients. And so I guess I want to emphasize that it's not the technology itself, it's, you know, who is using the technology and how it's being used. So if there's essentially a shadow employer where the app becomes another employer that is distancing itself from responsibility, then that's, and actually kind of controlling work through the app, that's one thing, but it's not sort of the technology itself. Maybe that's obvious to labor process scholars, but certainly you have, you know, other models. And why I'm looking outside of unions as well is because you know, some people with very intermittent services do need multiple workers. And so is there a way to think about organizing self-employed contractors and in that sense, you know, expanding labor law so that self-employed workers, self-employed people who were like workers, right? Dependent contractors, sometimes they're called, can organize. In that sense, the app can really, I think those kinds of technologies can work for workers to organize their clients and for people to find multiple workers. So that's a great question. I think there is also with the pandemic in Toronto, there was some discussion about, you know, the solution during the pandemic to get, you know, more care into people's home is an app, right? But it wasn't nonprofit, it wasn't a cooperative, it wasn't a workers organization pushing it. So it was kind of the Uberization of the care, arguing that during the pandemic, this is something that will become even more important. So yeah, there was a whole kind of series in the Toronto Star in the newspaper about it. So thanks for the question. That's certainly where things are going. Good question. Thanks.
Oh, I was just going to ask about the pandemic, but you've gotten to that. So I know it's not a fair question because you researched the book probably 5 years ago or something. But yeah, no, I was just curious about you know what you've seen from the pandemic. You know, obviously because so many people were in their homes, but other people weren't. Not everyone could, you know, could shelter in place, and so I guess, you know, exacerbating the problems, perhaps leading more or motivating more people for action to change the way this works. Yeah, was sort of the thrust of my curiosity.
I mean, I do think that there's been more space to talk about universal, you know, funding and more funding. I mean, the focus is largely, I don't know if it's similar in the UK, but the focus has largely been on long-term residential care. I mean, rightly so, people are dying and the conditions there are horrific. And, you know, here we had like the military, you know, coming into long-term care homes to just deal with the crisis and also document problems that people have been writing reports. People like Pat Armstrong and other care scholars have been writing reports about the problems in long-term residential care for 10 years, and they're the same problems, right? And so, but again, when I looked at the media coverage, home care is like the second cousin, right? It's not, but it upholds the healthcare and long-term care system, right? And it's upheld also as the ideal, but largely based on this idolized, like feminine, you know, a woman at home that's doing most of the work, right? And so there is more conversation about home care. There's more discussion about home care because of the critique of long-term residential care. Like now there's more evaluation of why do we have people living in these congregate environments? Like we need to put more money into home care. But home care was already so underfunded that if you have more people into home care, yes, you need more money, but you need even more money, right? So I am hopeful that the discussion about funding is being had. Like, there's a lot of, you know, public policy and social policy think tanks that are having talks in conversation with government and pushing government in different provinces, in Quebec, in Ontario, and BC, and in different provinces, and talking also about a federal standard. So I do think that there's hope there. What we saw initially with the pandemic, though, was, you know, worsening precarity that I would extrapolate from my research would have racialized effect, meaning that, you know, some clients were canceling home care visits because they were worried about the pandemic. And initially home care workers weren't given enough PPE, and we had these requirements that people couldn't work in multiple long-term care facilities to spread the virus, but there wasn't that in home care. And a lot of workers in home care also work in long-term care facilities, yet there was no, you know, regulations, like if you work in long-term care, you can't do home care. So people were understandably worried about having people come in. And so in home care, they have multiple workers. So what they were doing was kind of canceling with the, you know, keeping the favorite worker and hoping that worker would come more and do more. And so if I was going to extrapolate, so I saw that in the media, and social movement groups started to talk about this. And so if I was going to extrapolate from the racialized discrimination that I often found in my study, that this kind of would have racialized effect. You know, which worker is going to be the favorite worker that people keep? Which worker is going to be the one whose hours are canceled, right? Who don't get equivalent hours. That's going to, I would, you know, assume and hypothesize, have racialized effects. Also, there's new kind of tensions in the labor process. The Filipino Worker Center colleagues, one of the organizers named Lolita Ledo, told me that also in that private model, people were wanting their one worker to come in and now live in and do everything, right? And so turning home care into live-in domestic work was one of the strategies that people had to limit their own health and safety risks. So there's certainly these linked health and safety risks, right? That both the workers and the clients are the ones who are experiencing these risks, but there is this, I think, racialized worsening precarity that's been exacerbated. But I do want to say there's hope at the public policy level in terms of the discussion around funding.
Thanks, Cynthia. I think we've got time for just one last question. George?
Okay, great.
Hi, Cynthia. Thanks for the presentation. I found it really interesting, particularly as someone who has worked in care in the past.
Okay.
I was interested to find out, like, how that move you spoke about removing like descriptions of common activities and stuff from care plans, how that was received by workers and how that sort of impacted on how they carried out their role.
Mm-hmm. Yeah, that's a really good question. So at the time when I did that interview, they hadn't yet taken it out, but they were discussing taking it out. But the workers in that model, what I found was they were open to this flexible policy of what their job entailed, as long as it didn't go over their time. And it usually didn't, because there were more generous hours, right? And so I think that the workers would be open to that, particularly if they had a say in it. So, for example, I can give you another example of a policy that did happen, and I could see the effects after the case. So they had in certain collective agreements had even negotiated, like I said, a pet care policy, because it got to be, so the idea of independent living, which you may know if you were a care worker in this sector, is sort of help with activities that one would do if they were able-bodied. And so pet care can be part of that, but are you working with the person, alongside that person, to care for the pet? They're directing you, or they have directed you previously? Or is it that, you know, you're away on vacation and somebody is taking care of your pet when you're not there, right? And so these were the lines that workers were like, I agree with independent living, but this is where I see it morphing into servitude. And this is where we need to have a discussion around, you know, able-bodied people have to find somebody else to take care of their pets when they're on vacation. we shouldn't be coming in and cleaning the house when you're not there. If it's independent living, we're essentially cleaning the house together, right? And you're directing me, you know, you might not be micromanaging me because I've been here a long time and I know how you like things, but I'm not cleaning the house while you're away. Because I'm not a house cleaner, I'm an independent living worker. And so that's an example of where the workers were able, because they had a union, and this is, as I said, one of the reasons why they organized a union, but to actually discuss with the consumers what independent living was. So one of the real key activists in the union was like, I'm much more than arms and legs. So very contesting this independent living movement kind of, I don't want to say mantra, but idea that you know, we're physically don't have our use of our arms and legs perhaps, but we are mentally here, which comes from a history of marginalization, institutionalization, the idea that people with physical disabilities are also somehow developmentally disabled. So it comes from a certain place, but the workers, this activist said, you know, that's insulting to me. I'm much more than that. I have a mind and I put my mind and my spirit into this work, right? And so those discussions were able to be had in those contexts. And this is the other labor process tension I didn't talk about, I call knowledge versus skill. So people with disabilities have this knowledge of their bodies and how they work, but workers also have a skill. But what kind of skill is it? So people with disabilities reject a kind of standardized skill that training in long-term care facilities and a medical model. But it's a very much a skill to know an individual's routine and how to work with a complex, you know, somebody with a spinal cord injury, complex bowel routine. And that is also skill, but it's a different kind of skill. And then there's the relational skills that feminist scholarship talks about, right? And so that tension between knowledge and skill was also mediated in these environments where both sides had collective support. So I hope that gives you a sense a little bit about, I didn't follow up about the other policy, and it was more of an idea when I was doing my research.
Well, thank you very much.
Thank you.
That was a fascinating presentation. Thank you everyone for really interesting questions and your reflections, Cynthia. So yeah, so
thank you.
And I really look forward to the opportunity for us to meet in person again, but it's wonderful to have you here virtually and have that opportunity. So thank you very much again for joining us.
Thank you so much for having me and spending the time with me this afternoon for you.
Thank you.
Take care.